This case is an example of asymptomatic bacteria in the elderly. An 8-year-old woman in a nursing home has a urine dipstick showing positive nitrites and leukocytes. Positive leukocytes in her urine dipstick. She has no urinary symptoms, so the patient is asymptomatic. No fever and is clinically well. Blood tests show mild leukocytosis. So the urine dipstick is positive for leukocytes and the blood test show mild leukocytosis. What is the most appropriate management? Start oral antibiotics, repeat urine culture, admit for intravenous antibiotics, perform renal ultrasound, no treatment required. The correct answer is no treatment required. Explanation: the patient is asymptomatic with bacteria. Asymptomatic bacteria is common in the elderly. In the absence of urinary symptoms, antibiotic treatment is not indicated. So antibiotic treatment is not indicated in the absence of urinary symptoms. When the patient is asymptomatic, has no urinary symptoms. When the patient has no urinary symptoms, no antibiotic treatment required. However, this patient has asymptomatic bacteria which is common in the elderly. Why antibiotic treatment is not indicated in asymptomatic patient? As it doesn't improve the outcome and increases the antimicrobial resistance. So the antibiotic treatment, if given in an old age, it will increase the antimicrobial resistance and it will not improve the outcome. Why the other options are incorrect? Antibiotics cause harm without benefit. So the antibiotics will cause harm if not indicated, if there is no urinary symptoms. Repeat cultures are unnecessary. Without symptoms, if the symptoms start to appear, so you need to repeat the culture. Hospital admission is inappropriate unless there is urinary symptoms. Imaging is not indicated as there is no urinary symptoms. So no symptoms, no further imaging, no repeat culture, no antibiotic treatment. So no further investigations or treatment required. So you need to know that in the elderly, asymptomatic bacteria is common, and in the elderly diabetic patients with symptoms as dysuria, emphysematous cystitis is common. So emphysematous cystitis should be considered in diabetic female with dysuria, with symptoms. In diabetic symptomatic female with urinary symptoms, emphysematous cystitis should be considered. This is axial unenhanced CT images through the urinary bladder, show multiple punctured foci of gas delineating the bladder wall. So here there are multiple foci of gas delineating the bladder wall. There is also intraluminal gas. This is the urinary bladder lumen and this is the fluid within the urinary bladder and this is the gas. This is the air fluid level. So there is also intraluminal gas within the urinary bladder. So the urinary bladder wall is thickened with multiple punctate foci of gas delineating the bladder wall and as well as intraluminal gas, indicating a gas producing organism, indicating infection of the urinary bladder with a gas producing organism. So, emphysematous cystitis is a complicated lower urinary tract infection that is characterized by gas within the wall and within the lumen of the bladder. It is the most common gas-forming infection of the urinary tract. So, emphysematous cystitis, it is the most common gas-forming infection in the urinary tract. 2/3 of patients with emphysematous cystitis are diabetic. Clinical presentation varies from asymptomatic to dysuria to severe sepsis. E. coli, Escherichia coli is the most common cause, the most common gas-producing organism. So E. coli is the most common gas-producing organism to cause emphysematous cystitis, along with Klebsiella. So E. coli and Klebsiella. So emphysematous starts with E, emphysematous, E. coli, okay, and Klebsiella. Emphysematous cystitis has much better prognosis than emphysematous pyelonephritis. Okay, if emphysematous cystitis is not treated, infection may spread to the upper urinary tract. So the management, patients are usually treated with intravenous antibiotics, and surgery may be needed in severe cases. So intravenous antibiotic is indicated in emphysematous cystitis. However, here, in this case, no need for intravenous antibiotic, which needs admission, hospital admission, to start the intravenous antibiotic. Okay, so in this patient, there is no need for hospital admission, or intravenous antibiotics, as this case is not emphysematous cystitis. And also oral antibiotics is not required in this case as there is no urinary symptoms.